All right, let's bring in MS Now Capitol Hill reporter Kevin Fry. We also have with us senior national correspondent at The Bulwark, Jonathan Cohn, and former chief medical officer at the CDC, Dr. Deborah Howry. Kevin, you are there. I know you've been watching this all morning. How would you sum up what has unfolded?
Dramatic, theatrical, and somewhat predictable, I think, would probably be the best way to put a bow around all of this. We knew going into this that we expected Republicans to really press him, particularly on this new information they have in this 1,000-plus page trove of documents of quote-unquote diary entries that they received from the Department of Health and Human Services in the last few days. Senator Paul posted them online over the weekend, and they raised questions, Republicans would argue, about what Fauci knew and when he knew it. But in the background of all of this, as you just laid out, is this question of potential perjury. And would Republicans, especially Senator Rand Paul, who has called in the past for Fauci to be arrested, to be jailed, to be prosecuted, could anything Fauci say end up landing him in legal trouble? That was one of the outstanding questions. And so you saw Fauci explain in his opening remarks why he was going to proceed with taking the fifth. Here's what he said.
The only conclusion I can reach is that the sole reason he is calling me before this committee is to get me to say something, anything, that could vindicate his repeated public pledges that I end up, in his words, quote, behind bars. I will invoke my right under the Fifth Amendment of the Constitution to refrain from answering your questions.
And in terms of just the play out here, we have seen Republicans on this committee ask repeated questions over and over and over again. Fauci has pled the fifth each time. Democrats have largely taken their moment to either defend Fauci, defend the chaos and confusion that was the early days of the COVID pandemic, or point the finger at the committee and say we should actually be reviewing some of the health issues that are going on right now, such as the rise in measles cases. The one other thing I will add here is that obviously Fauci has faced questions based on these documents about his own celebrity status and whether or not he was reveling in that. That was another thing that Republicans are trying to point the finger at here, kind of pasting him as vain and all about himself.
Yeah, I want to dig in on a few of those points that you raised there, Kevin. But Jonathan, I want your take first on what we've heard from the lawmakers who've had the chance to ask him questions this morning. None of them have really been answered. But do you think any of them asked serious questions? Or would you say that the majority of this has been about scoring political points? I ask because Dr. Vin Gupta was on with my colleague Stephanie Ruhle just a little bit ago. And he said that, for example, Senator Lankford had some questions that he thought were actually interesting and fair. And so I wonder if you can basically help us cut through the noise here, separate sort of fact and from fiction and from drama.
Yeah. So, I mean, look, there are a few questions that are legitimate. And you know, looking back over the pandemic, I mean, I think a lot of us have said for a long time, it was a once in a century challenge. We did some things right. We did some things wrong. Human beings were making decisions. We should continue to look back and have a sober examination of what we got right, what we got wrong, so we could do better next time. The problem is that is not what this show is. This is a show trial. This is Rand Paul deeply invested in this narrative that there was a conspiracy. Is Ron Johnson deeply invested in this narrative that scientists are misleading the country? Is Donald Trump deeply invested in taking out vengeance on Fauci, who he thinks helped ruin his first term? And that is what this is all about. And that is why Fauci doesn't want to answer questions, because he fears legitimately the real purpose of this is not to have a careful, thoughtful retrospective on how we handled the last pandemic and do better next time. It is an effort to get him, extract vengeance on him and put him in jail.
Dr. Howry, has the CDC under this administration, I mean, I think some Americans may be watching this unfold this morning thinking, there are a couple crises going on right now. I keep hearing about a diarrhea outbreak around the country. Measles is back. And they may be wondering to themselves sort of, well, why are we relitigating all of this? And I'm just wondering your assessment. the CDC under this administration, have they modeled the kind of transparency that these lawmakers are right now demanding from Fauci?
Unfortunately not. And I'd say that's really the CDC political leadership that's not modeling transparency. I agree with what Kevin and Jonathan said. And certainly CDC learned a lot of lessons during COVID and looked at how they could improve data, communicating with the public, being ready to respond more quickly. But what we've seen is guidance coming out of the CDC recently that disagrees with the science, and it's coming from the political leadership. So that's not radical transparency. And it's really the opposite of what we should be doing post-COVID. And you're right. We should be focusing on measles right now, Ebola, the foodborne outbreaks, versus relitigating things from years ago when we aren't looking for a solution.
So I guess, Kevin, what do you think then Republicans think they are getting for themselves out of what you've described as this sort of theatrical and somewhat at times chaotic hearing this morning? Because if it doesn't get at the urgent issues that Americans are living with and dealing with right now, we know that the midterms are less than 100 days away right now. What do Republicans think that they will get from this if they're not going to get answers from Fauci himself?
Yeah, I mean, that is one of the key questions coming out of this hearing, as we in the press have been talking to the lawmakers as they've exited, is kind of like, okay, what is the next step and kind of what are the goals here? And no one really has a good explanation as to what they do now in terms of this investigation. I mean, one of the things that I was getting at is, okay, like, what are you actually trying to, like, if you can't get him on perjury, but you wanted him to testify and you're mad he's taking the fifth, like, what exactly was the goal here? Why should he be then testifying? And they basically argued this was about, a public accountability. At the end of the day, what Senator Gallego said to me yesterday in the lead up to this, I think rings somewhat true, is that the Republicans are on this committee trying to relitigate something that certainly fires up their base, that are still mad about the COVID restrictions, about the years after COVID, and want that this still is an animating feature for members of their party. Obviously, we are inching closer and closer to the midterms, so perhaps galvanizing them in some way could be useful. But one could also argue, as Democrats also have argued to me, that this was basically an example of a vendetta being operated by Rand Paul, and that this was just the latest chapter in a tete-a-tete that has gone on now for 5 years that Rand Paul will not let go.
Dr. Howery, I wonder, when you look at some of what has been, reported on and uncovered in these diary entries and pushed forward by Republicans, if there are any elements that you think Dr. Fauci or others should talk to the American public about more clearly and more in depth. I ask, for example, some of the lockdown-related contradictions. In 2024, in testimony, he told the House Oversight Committee that he was not involved in state and local school closure decisions. And then in the diary, Republicans have put forward, March 15th, 2020, he writes that de Blasio closed NYC schools based on a conversation that he had with de Blasio. Are there some areas in which the public deserves to know a little bit more about Fauci's real-time decision-making and responsibility at the time?
So I think, what I took away from this is, science changes. We need to update the public when that happens. And one of the, crisis and risk communications is saying what we know now and what we don't know and how you close that gap. I think what concerns me is career scientists, it seems like they're being politicized or persecuted when they have a difference of opinion or when science evolves. And it should be about accountability, being transparent to the American public, and not about being prosecuted. Dr. Fauci's successor raised concerns about political interference, and her job was terminated. So I'm really concerned about the toll this is having on career scientists being able to serve the public.
Jonathan, what would you say to people who are picking apart these sections that have to do with his own reflections on his fame, the celebrities that he called to answer questions for them during the pandemic? A lot of hay being made from that piece. Do you see that as sort of wholly separate from the question of the science and the actual public health realities that we lived with, are living with now? Or do you think there are real challenges there?
I think my takeaway is that Anthony Fauci is a human being. He's in the middle of this storm, all this chaos going on, and he's like, wow, I got to meet Julia Roberts. Well, you know what? If I got to meet Julia Roberts and talk to her, I'd say, wow, too. She's Julia Roberts. But, the main takeaway from all these diaries is that he was deeply serious, invested, trying to figure out the science. And what Dr. Howery was just describing, I feel like people forget. It was chaos for the first few months. Nobody knew how to deal with this. It was overload on all systems, healthcare providers at the level of government. Everybody was trying to figure out what was going on. Fauci was doing his best. He made some mistakes like everybody did, but he was trying to follow the science, trying to do the best job possible. And don't forget, in an administration where the president of the United States was a chief source of misinformation, chaos, and trying desperately to deny the problem purely because he thought it might hurt his chances for re-election.